Giant Health 2018, live from Stamford Bridge. I'm now joined by, I'm delighted to be joined by Amina Albeyatti. Got that right? Yeah, the surname. Medicalchain. So you're part of Medicalchain. You're the business development executive there as well. Is that right as well? So what brings you here this year at Giant Health 2018?
So it's our second year at Giant Health. It's a great time to meet other people that are innovators like ourselves, meet other clinicians. We're all about collaboration and working together, and that's what we're trying to do. Find people that are like-minded, that want to work together and build something brilliant for the future.
Yeah. No, I mean, we're getting more and more people coming up here and coming on the show, really, talking about how happy they are that they decided to come here this year. What's your main reasons for coming to this year's Giant, though? Is it to talk to certain people? Is it to come and talk on the stage? Or is it to find potentially new business as well?
So I suppose there's two main reasons. Yes, we are speaking on the stage. Yes, we are meeting potential partners for the future. But the key is to get our message out there, talking about the use of blockchain in healthcare records and the future that we have for the healthcare system, both in the NHS and globally. And also, like I said, to find partners to collaborate with, other innovators that are working in the similar ideology of ourselves, to get the patient at the heart of their health, to let them lead from the front and to work together so we can get a brilliant product at the end of the day.
Now, I mean, a lot of people are talking about blockchain and there's a lot of skepticism around it as well. Yeah. Okay, what's your truest opinion on it from a personal perspective as a GP as well, but also from a professional standpoint as well? What's your...
So I think there's been a lot of hype about blockchain. The blockchain will solve everything and anything. And especially when the Bitcoin price was going up, everyone's very excited. And now that it's all kind of calmed down, the excitement and the buzz is gone. But I think people are missing that the blockchain technology itself is innovative. It protects data in a way that we haven't been able to protect in the past. And for electronic health records, that's why there's a change now that we can make a big difference for the future. As a GP, the ability to be able to see patients' healthcare records all the time, anytime, is going to be a dramatic difference to the way I practice. I can make sure that my patients are safe and healthy at all times. I can keep tabs on what's going on when they go to the clinic, when they go for a blood test. I have patients that come in and I have no idea what happened just yesterday when they were in A&E. They don't know because they don't have any record of it. I don't know, and so I can't help them, and it's very frustrating for me and for the patient. So I think it's key that we can have that, and being protected by the blockchain means that I can feel secure that I'm putting that data in a way that is uncorruptible, that can't be abused. So it's really important for me as a GP and a professional.
No, absolutely. And Medicalchain as well, you talk about the wanting to improve the efficiency really of the NHS as well. This is what a lot of people are on the show for, and improving it more. What are you guys doing there at Medicalchain to look at helping the NHS as partners and consultants to improve it more as well?
So, like all healthcare systems around the world, the NHS is not on its own. There are lots of flaws and lots of inefficiencies that can always be improved and updated every few years. The main thing that we have found at this moment for the next kind of 2 to 3 years' time is that there isn't enough communication between doctors and other clinicians, and between those clinicians and the patient. So that's a key, and that inefficiency is causing a lot of loss of money and loss of time and loss of appointments. We also have a lack of doctors and nurses at presently, and if we waste those resources by not sending the letters out appropriately to patients, by not faxing them, can you believe we still use fax machines in the NHS? Patients get lost. I mean, I had a patient just last week that has been delayed to have his biopsy for cancer by 6 months because his letter didn't arrive.
Yeah.
And this day and age, we just cannot accept that anymore. We have to find a solution because every life matters, and that poor patient is going to have such a dramatic effect to his health now because of a simple clerical error. So the way we want to help the NHS is by making their clerical and administrative system more productive and more efficient. Kind of cut out the middleman, cut out all the necessities for making phone calls, doing fax machines, repeating the same information repetitively by specialists, by GP, by physiotherapists. We want to kind of put it on one sheet of paper or in a digital format that the patient can access, all the clinicians can access, and we can all work together to get the best outcome for the patient.
No, I mean, I think that's what gives you an advantage in this role as well, isn't it, for Medicalchain, is the fact that you being a general practitioner, I should have mentioned that to everybody beforehand. Amina is a GP here as well. Because of the fact that you've got that insight into how the NHS works as well, I suppose that for doing your job on a business development side of things, you have that insight on the ground, really, essentially.
So I can appreciate all the issues that come across myself and my colleagues, I have just under 10 years experience as working in secondary practice and general surgery. So that also leads to the fact that I can understand what happens when they get to hospital as well. And we're trying to bridge that massive gap now between primary and secondary care, and then also social care that happens once you leave your GP practice and your secondary care provider, because it's key that the whole system works well with each other and is flexible and dynamic.
How long do you reckon you're going to give it in terms of time when the NHS, I know that a lot of companies are saying they want to go paperless and wanted to eradicate it all, but when will we see the time when the NHS will be solely all digital, or do you reckon there'll never be a time when that
I think
will
there has to be a time for it, and I think the only time we can have that change is on two fronts: when the patients demand it, and that we follow normally what the patient's demand is. So if the patients want it, we will do it, and also policymakers can appreciate the massive difference it will make in the economy of the NHS and how much billions of pounds they are going to be able to save, and so that we don't have to keep cutting services, but instead we'll make the system more productive. Then we'll get a change. Both ends, patients, policymakers, the doctors are ready to do that anyway.
No, I think so. And just to sum up quickly, are you looking forward to seeing anything in particular at Giant for the rest of the day at all? Is there any conversations you're part of? Or?
Well, I'll be presenting around about 2 o'clock on the main stage. So if anyone's interested to come and join us and have a little chit chat, that would be great. But mostly just to meet other innovators like ourselves and hopefully start the conversation to collaborate, which is our key.
I think so, and I think it's a real important conversation to be having about, essentially eradicating all these hiccups going to happen. So, everybody, that was Amina Albeyatti there of Medicalchain. Thank you very much for coming on this show today. We're going to take a quick break now shortly. We're now into